Good afternoon, I'm Mayor Tom Merritt. I'm joined by Dr. Swine from the Health Department. At 2 o'clock Eastern Time this afternoon, the Centers for Disease Control updated its interim guidance for schools and child care facilities regarding the prevention of the spread of influenza H1N1 virus. In accordance with these newly issued CDC guidelines, we will not be closing additional schools in Milwaukee at this time due to the flu cases. In addition, as of tomorrow, Wednesday, previously closed public and private schools and child care facilities can be reopened. I have spoken to Superintendent Andrikopoulos within the last half hour, and he informed me, given this news, that the Milwaukee Public Schools will be reopened tomorrow. Those schools that have been closed will be reopening tomorrow. So I want to get that information out to the community. When we talked on Sunday about this issue, we said that parents should plan to expect that the schools may be closed for this entire week. In light of this recent development, of course, we want to get the word out as quickly and as much in a widespread fashion as we can, that students and staff are expected to attend school tomorrow. I also want to point out, though, that the new CDC guidance on school closures does not mean that the flu virus has vanished. In fact, we're continuing to see more cases throughout the nation. But what the guidance recognizes is that the virus is not so severe to warrant school closings at this time. Dr. Swine will probably touch on this a little bit later, but I also want to point out, as we look at the history, for example, of the 1918 flu epidemic in this country, that flu epidemic came in a lighter form or a less severe form in the springtime, and then came back with a vengeance in the fall. The reason I mention that is we are continuously on guard now, and our health department, which has done a phenomenal job in working to contact individuals who have contracted the flu, is going to remain vigilant. It is our hope and expectation that we will not see a repeat of what we saw some 91 years ago. At the same time, I don't want people to feel as though we're completely out of the woods as far as the flu goes. Dr. Swine will talk more about what individuals should do if they are showing symptoms and what students in particular should do. I also want our residents to be assured that our city remains vigilant in this situation, and again, that our health department is taking prudent efforts to protect the health of our community. With that, I'll turn it over to Dr. Swine. Doctor.
Thank you, Mayor. I'm Josh Swine. I'm the Medical Director and Chief Medical Officer of the Milwaukee Health Department. We appreciate your coming today for this update. As the Mayor said, we are no longer recommending closing additional schools in the city, and we are fine with reopening the schools that were ordered closed in the past week. This decision is based on our own analysis of local and national information, as well as the brand new CDC guidance that the Mayor referred to. I want to emphasize that the CDC guidance has been based on their analysis of the severity of this disease, not on its prevalence. As the Mayor said, this disease is widespread in our community. It's the severity that has allowed the CDC to change its guidance on school closures and allowed us to follow suit. In summary, previously closed public and private schools in the city, as well as child care facilities, may be reopened tomorrow according to the following Milwaukee Health Department recommendations. First, any student, faculty, or staff in school or child care settings with symptoms of influenza may not attend school or child care until at least 7 days have elapsed since symptom onset and until 24 hours after symptoms have resolved, even if that takes longer than 7 days. As we've said all week, symptoms include fever, sore throat, cough, and runny nose, among others. We are asking parents and guardians to monitor their school-aged children or child care attendees every morning, and faculty and staff should self-monitor every morning for symptoms of respiratory illness and stay home if they have them. Students faculty and staff who are experiencing any of those symptoms should stay home in any case, but especially should refrain from participating in any extracurricular activities, sports, school events, any gatherings this evening. We're trying still to limit the spread of this disease. Faculty and staff at schools and child care facilities who become ill with any of those symptoms during the course of the school day or child care day are expected to go home as quickly as possible and stay home for the duration I outlined. Students who become ill with any of those symptoms during the school day or child care day should be promptly isolated in a room separate from others and sent home for that same period of time I mentioned. Students, faculty, and staff who become ill during the day should not go home via public transportation or mass transit. Again, ill students, faculty, and staff should stay home. This also means that they should not attend an alternative school or another child care setting. Again, for that same period of time. Finally, we ask that all schools and child care facilities continue to emphasize and in fact increase their emphasis on good hand hygiene and cough etiquette, including frequent hand washing with soap and water or hand sanitizers, as well as the use of tissue. Soap and water or hand sanitizer should be made readily available to everyone in such settings. The City of Milwaukee Health Department will continue to work very closely with the Milwaukee Public School System and other schools and school systems in the area, including child care facilities, to monitor symptoms and student absenteeism in the coming weeks. The City of Milwaukee Health Department may invoke closure of a school or child care setting should the magnitude of illness among students, faculty, and staff at that site warrant such action. We will continue to closely monitor cases within our community and throughout the nation and the world. As new guidance from the CDC becomes available and as we learn more information, the Milwaukee Health Department will continue to refine its actions and responses. In addition to this information about schools, I want to give you also an update on the bigger picture of where we're at with cases. Today, we are reporting that there are a total of 93 probable and confirmed cases within the city of Milwaukee. I want to stress here something about probable cases. It's important for people to know that probable cases are highly, highly likely. We anticipate that at least 95% of all probable cases will become confirmed when the lab backlogs start to dissipate. So again, we are strongly urging all people in Milwaukee who are exhibiting signs of respiratory illness to stay home. Finally, and that includes not just faculty and students and staff, but any employee, any person, stay home from work if you're sick, please. Finally, I want to point out that even though the swine influenza in the U.S. does not appear at this point to be as severe as early reports from Mexico indicated, and even though the CDC now feels it is not severe enough to warrant automatic school closure, it is clear that this swine influenza, as the mayor pointed out, is still a serious illness. It is widespread in our community. And even if it is no more severe than regular seasonal influenza, many people around the country, including here in Milwaukee, will likely be hospitalized for this infection, and some, perhaps many, will die. Remember, this is a brand new virus to which no one has immunity and for which there is no vaccine. We need, and we are asking for, the full cooperation of this community in order to slow this disease and limit its spread. If you are ill, please stay home.